Without his medicine, he could die.
The cost of care in focus.
There's not a lot we can do on our end to bring that price down.
Americans now paying more than ever for the most common health plans. Still, some critical costs are now capped.
We're here today to talk about how we're lowering prices and cracking down on unfair competition in prescription drugs.
8 in 10 adults now asking the presidential candidates to address their health care concerns.
This is not right. We need to be able to afford our medicine.
It's a top issue as America prepares to vote. This is a special edition of Scripps News Reports, Path to the White House. I'm Charles Benson in Milwaukee. I've been reporting from here for 35 years, covering countless elections, speaking with candidates and voters. What happens in Wisconsin is critical to the country. This is a battleground state, one of just a handful of crucial swing states. There's a roughly even split here between Democrats and Republicans. Consider this. Since the year 2000, 3 presidential elections have all been decided here by less than 1 percentage point. And top of mind this cycle, the cost of health care. This half hour, we dig into the reasons why, the dueling plans from Presidents Biden and Trump, and hear from real voters, the voices of people, not pundits. Juliana Zoet likes to spend quality time with her son Christian. She has a good paying job and her employer provides health insurance. But Juliana still worries about medical bills thanks to a $3,200 yearly deductible.
The deductibles are so high. Just out of pocket, I'm still paying from 2023 and 2024 on a payment plan.
When Julie Buckholt is feeling stressed about her life-threatening illness, she pulls out her paintbrushes.
It's a flower pot on a chair.
There are days when her rare neuromuscular disease impacts every part of her body, from eating to breathing to smiling.
Yeah.
If she won $1 million, it wouldn't be enough to cover all her weekly infusions.
These costs of these medications are out of control.
When the Milwaukee educator went on disability, Medicare helped cover her costs, but she also leans in on charitable foundations for financial help. Prior to that, she became a big fan of the Affordable Care Act that ended lifetime limits on benefits and protected families like hers with pre-existing conditions. But challenges exist.
So what needs to be fixed?
Well, I think we need to have easier access to doctors, because if, with an illness like this and you're waiting to see a specialist, it's very frustrating.
President Biden's Inflation Reduction Act is expected to provide financial relief to millions on Medicare struggling with very expensive prescription drugs by negotiating lower prices and capping out-of-pocket costs. Javier Becerra is the U.S. Secretary of Health and Human Services. What more needs to be done to lower all drugs across the board?
Well, we got to pull the curtain that's masking how drug pricing is done.
The new law will allow the Secretary to negotiate with drug companies on a selected 10 specific drugs covered by Medicare Part D.
We want the manufacturers to still make their profit, but we don't want to pay hyper-extended prices.
In his first term, former President Trump signed the Right to Try law to make experimental drug treatments available for people facing terminal illness. Trump has talked about replacing the Affordable Care Act, but it's unclear how or what that would look like. Tommy Thompson is the 4-time elected Republican governor and was U.S. Secretary of Health and Human Services under President George W. Bush. Is it on life support? What are the challenges in the health?
It's not on life support, but it has some serious problems.
Problems that Thompson partially blames on too many rules and regulations that make the healthcare system less efficient and accessible. He believes innovation is needed to allow doctors and nurses more time to see more patients.
There are a lot of regulations we have that people don't adhere to. We should get rid of those. We should make it more streamlined and efficient.
For Juliana,
And I think we could all benefit from coming together.
the sooner, the better. President Trump did not repeal the Affordable Care Act despite his promises during his 4 years in office. Now back on the campaign trail, Trump is again promising to replace it. On the flip side, President Biden has expanded the Affordable Care Act during his term, with a record number of Americans now enrolled, more than 20 million. Stephanie Liebergen reports on the state of it all.
This year, 45 million Americans have health insurance thanks to the Affordable Care Act. Enrollment is up nearly 50% from just 4 years ago. Experts attribute that increase, at least in part, to expanded subsidies signed by President Biden in 2022. And some of the biggest increases in coverage happened in southern conservative states.
Many of them have not expanded Medicaid, which has contributed to their high uninsured rates. But with these new subsidies that have been available, it's really helped people who were uninsured afford coverage for the first time.
10 years after the ACA's problem-plagued rollout, experts say both consumers and health insurance companies participating in the marketplace are doing well.
We're seeing more insurance companies enter in. The trade-off here is that this costs the federal government more money.
A February poll from KFF found 59% of Americans have a positive view of the ACA, also known as Obamacare. But in the same survey, voters said health care costs are still a top issue. On the campaign trail, former President Trump has repeatedly criticized the ACA, calling the cost, quote, out of control, and saying America has one of the worst health care plans in the world.
We're going to make it much better, much stronger. In other words, make the ACA much, much better and far less money cost to the people.
When Trump talks about making the Affordable Care Act better, it's hard to know exactly what that means. And I think what we experienced in 2017 is that the devil's in the details.
When then President Trump tried to repeal the ACA in 2017, the Congressional Budget Office estimated that within 10 years, 32 million people would lose health insurance and premiums would double. Throughout his first administration, Trump repeatedly said a new health care proposal was on the horizon, but never released a plan. A letter signed by 48 healthcare officials, including multiple military doctors and former surgeons general, raised serious concerns about a second Trump administration. They wrote, quote, while his specific policies are at best ambiguous, his track record and his words make clear the damage he would do. The current subsidies, credited with boosting health insurance coverage, are due to expire next year. That will likely set up a heated debate between the next Congress and the next president on whether those subsidies should be extended. Stephanie Liebergen, Scripps News, Washington.
Ahead, the voices of people, not pundits. From the cost of care to expanded coverage. We'll make sense of it all. And Medicare, now directly negotiating the prices of 10 drugs. What took so long? And will that mean lower costs for all?
For many Americans, health care is the most important issue for them when it comes to presidential elections. And on this issue, there are certainly stark differences between former President Trump and President Biden. Take, for instance, the Affordable Care Act, which is at the heart of many health policy debates. It was signed into law by President Obama in 2010 and created an exchange so anyone can get health insurance. It opened the door for states to expand Medicaid and permitted children to stay on their parents' plans until age 26. President Biden supports the law and efforts to expand it and has boasted about how a record number of Americans are currently getting health care because of it. Former President Trump, during his first term, tried to repeal and replace the Affordable Care Act. That did not happen. In a Truth Social post last year, Mr. Trump said, the cost of Obamacare is out of control. Plus, it's not good health care. I'm seriously looking at alternatives. There are some areas of agreement between President Biden and former President Trump. For instance, on price transparency, former President Trump signed into law the No Surprises Act, which cracks down on unexpected bills for some patients. Trump ordered hospitals to publish prices for some services. President Biden has supported both of those efforts. Of course, you can't talk about health care without prescription drugs, and there are key differences. President Biden signed the Inflation Reduction Act, which caps out-of-pocket insulin costs at $35 a month for Medicare enrollees and allows Medicare to negotiate with drug companies. Beginning in 2025, the law will cap out-of-pocket drug costs at $2,000 a year for those on Medicare. Former President Trump has spoken critically of that law and has vowed to repeal it. On prescription drugs, Trump did support other forms of reform while in office and gave speeches where he said drug companies companies don't like him. He backs new regulations for drugs to be imported from Canada and has supported efforts to cut out the middlemen from drug discounting programs. Joe St. George, Scripps News, Washington.
That's a look at the politicians and their plans. The reality of healthcare is a mixed bag. More expensive plans, but expanded coverage. How does it all translate to our everyday lives? I sat down with a panel of people, not pundits.
I'm Ron Schmill from Delafield, Wisconsin. 60 years old. I'm a cancer survivor of 40 years. March 8th, I actually had a heart attack, had 2 stents put in, seemed to maybe have solved my problems, but I'm a user of health insurance, and my wife now is retiring June 2nd, and we will now go on COBRA and pay.
But your premiums are going to be high, your deductibles are going to be high. How will you navigate that?
Well, I guess we have to budget for it because our premiums will be $1,800 a month, and that's only for 18 months.
Peter, you kind of cringed there.
No, I mean, that's a lot of money. 1,800, that's an awful lot of money for anybody.
Well, and it's also, my deductible, our family out-of-pocket is $9,400.
And is that just for you or for the family?
Well, it's for the family, but theoretically mine would be $5,000. We just have to budget. We'll be 61 this year, so we have to make it 4 years to get on Medicare.
Are you looking forward to getting on Medicare because you think the system will be better for you, or does it worry you?
Well, I think Medicare will probably be better for me, but I want to slow the aging process down.
You don't want to turn 65 right away.
Exactly.
You just had heart surgery. Did you have any idea what it was going to cost you?
No. So far since January 1st, my insurance company has paid $233,000 for me, plus my $9,400 deductible.
Does that just blow you away?
It does. Luckily, I had the health insurance.
If you could sit down with the candidates?
I don't know if anybody has the answer. I think that's the downside. And they talk about it around election time, but after election, and they're in, it kind of stops.
My name is Kamar Carter. I have the House of Vitality. I grew up in the projects, and my mother, she was on the state insurance. So as I got older, I developed a family of my own. I had to pay for insurance through my job. Now where I worked at, it was we got paid piecework. So sometimes the place would get slow, and paying for family health care would take up my whole check, almost. Like I would have a couple dollars left over, and that was horrible. So it would be months where it would be hard to even get by paying bills. And I wound up with my own business after that, right? So now I'm at a point where I can pay for my own insurance, but it is expensive. I'm completely in agreement with health care. I feel like everybody needs health care. If you have a heart, you need to be trying to figure out how can we get health care to everybody.
Do you worry about paying your deductibles?
Oh, definitely, because I understand that. I feel like everything is all too high right now. It's too high for everybody. Like, we just heard his story. Like, that's ridiculous. I just think Republicans and Democrats, I think me and you talked about it the other day. If you love people, it's no reason why you can't sit down at a table and come up with something where everybody's happy. The people that have no means of getting insurance and the people that have a means but still not overcharging them. A lot of people in my community are actually living check to check. So, you know, you to lose a job, everything is gone once you lose your job. I'm just hoping I can be able to afford what's coming.
And stay healthy.
Exactly, but that's a worry in itself, you know what I'm saying?
Do you worry about your children? You're raising 4 children?
Exactly. I'm definitely worried about the kids, and that's where most of the worry is. You know, it's not me anymore, it's more so for them.
My name is Lynn Carey, and I live in southeastern Wisconsin. Healthcare has always been very important to me because my career has been as a nurse. I'm a retired nurse. So I was on the one side of the bed for a very long time, and then I became the patient. So it was really a complete change in my life.
So you're a double lung transplant?
I am. I had a double lung transplant. It will be 9 years on May 13th.
Well, we're glad you could be here.
It's a very expensive disease, as many diseases are. The other part of it for me is because I was on oxygen. I was very disabled. I wasn't able to perform my job. So when you lose your job in our country, you often lose your health insurance. And that never made sense to me. Why health insurance was tied to employment. Because if you're diagnosed with a life-threatening illness, as I was, then I lose my health insurance, and then what do you do?
So what did you do?
So I went on my husband's insurance.
You worried a lot.
I worry a lot, and I certainly worried over the course. Both my husband and I worked hard to own a home, and without insurance, that would not have been an option. That's right, exactly.
Lynn, if you had the candidate standing right here, you could say, look, what would you tell them?
I would tell them that we elect you because we put our trust into you. Your job is to get together, put past ideology, and talk about what is best for the citizens and how we can provide a healthcare system that will provide healthcare as a right, not as a privilege. The other piece for me in terms of Medicare, I like the discussion about making it available earlier. I would like to see it actually available to everyone. Well, I call it Medicare for all.
Medicare for all.
I have had a really good experience with Medicare.
I was in my own insurance business for 30 years. I also specialized in long-term care insurance. Only 6 Americans out of 100 have a way of paying for nursing home or home care. And it's very expensive to be cared for.
But what about your own situation? I mean, do you worry about healthcare costs?
No, the only thing I worry about if something really catastrophic happened, there's a cap to what I can spend in a year, and it happened in 2017. I hit the maximum because I had very major spinal surgery, and I was in rehab. I have long-term care insurance, and very few companies.
Is that affordable?
It's expensive, but
do you think everybody can afford that?
No, I don't. But it's one of the things that's helping me now. Otherwise, there'd be a lot of out-of-pocket expenses. I'm a big proponent of preventative health care. I would prefer, instead of healthcare being tied to a job, because people want to maybe change a job or they lose the job, if everybody had their own individual policy and belonged to a group where a group could cut the premium down. I mean, being tied to a job, that's not very efficient.
Up next, Medicare, now negotiating the prices of 10 drugs. What it means for the prices we all pay, whether we're on Medicare or not. A major issue in the lives of millions of Americans is the cost of health care, and specifically the cost of prescription drugs. As we speak, Medicare is negotiating the prices of 10 drugs, something it hasn't been able to do before. We asked Jennifer Glenfield to explain what took so long to get to this point and whether this will help Americans not on Medicare.
For the first time ever, Medicare is now negotiating the prices of some prescription drugs. That could mean lower costs, mainly for seniors, starting in 2026. Medicare had been prohibited from negotiating drug prices. The argument, less revenue for drug companies, would mean less innovation. But that changed when the Inflation Reduction Act passed along party lines.
Bernie, you and I have been fighting this for 25 years. Finally we beat Big Pharma. Finally.
When he was president, Donald Trump suggested Medicare be allowed to negotiate drug prices, but that didn't happen. He also proposed allowing Americans to import certain drugs.
I'm giving governors the right to go to Canada because they'll pay approximately 50% less for their drugs that they buy for their states.
Direct negotiations may have an impact beyond Medicare recipients. The hope lies in scale, with 60 million Americans on Medicare. Advocates think drug companies will have to cave on price or risk losing business to other drug makers. Drug makers have lobbied hard against reforms like these. They consistently spend more than any other industry lobby at $107 million so far this year. Last year, that number topped $382 million.
We should be more aggressive. It's time to negotiate lower prices for at least 50 drugs a year.
For now, only 10 drugs are up for negotiation, like Eliquis and Xarelto for blood clots, and Jardiance, Januvia, and Farxiga for diabetes. President Biden's moves to lower drug costs also include requiring manufacturers to pay rebates to Medicare if prices increase faster than inflation, and capping out-of-pocket drug costs down to $2,000 in 2025. President Trump fought pharmacy benefit managers, seen as middlemen incentivized to charge more for drugs. Most of the recent moves to cut prescription drug costs are riding on the power of Medicare and are credited to that Inflation Reduction Act passed in 2022. Jennifer Glenfield, Scripps News.
This half hour, we've been digging into the rising costs of healthcare, comparing the stances of the leading presidential candidates and hearing from people, not pundits. Here in Milwaukee, Republicans will hold their national convention in July. The Democrats will gather 90 miles south of here in Chicago for their convention in August. The push toward the presidency is well underway, and we'll be here with you all the way to Election Day. For now, in Milwaukee, I'm Charles Benson for Scripps News Reports.